Guys, my name is Dr. Anwar Farooq. Today we will be talk about Marfan syndrome, symptoms of its Marfan syndrome, causes of the Marfan syndrome, risk factor of the Marfan syndrome, complication of the Marfan syndrome, diagnosis of the Marfan syndrome, treatment of the Marfan syndrome. Marfan syndrome. This is an inherited disorder that affects connective tissue, heart, eyes, blood vessels, and skeleton. People with Marfan syndrome are usually tall and thin, with usually long arms, fingers, and toes. Sometimes in Marfan syndrome, the aorta is affected and become. This condition is called life-threatening. Symptoms of the Marfan syndrome. Marfan syndrome features may include tall and slender build, disproportionality, long arms, legs, and fingers, a breastbone that protrudes outward or dips inward, a high arched plate, and crowded teeth. Heart murmur, extreme nearsightedness, and abnormally curved spine, flat feet. Causes of the Marfan syndrome. Marfan syndrome is caused by a defect in the gene that enables your body to produce a protein that helps give connective tissues its elasticity and strength. Each child of an affected parents has a 50-50 chance of the inheriting the defective gene. In about 20% people develop mutation spontaneously. Risk factor of the Marfan syndrome. Marfan syndrome affects men and women equally and occurs among all races and ethnic groups because it is a genetic condition. The greatest risk factor of the Marfan syndrome is having a parents with the disorder. Cardiovascular complication. The most dangerous complication of the Marfan syndrome involve the heart and the blood vessels. Faulty connective tissue can weaken the aorta, aortic aneurysm. The pressure of blood leaving your heart can cause the wall of your aorta to bulge out like a weak spot in the tire. In people who have Marfan syndrome, this is the most likely to happen at the aortic root where the artery leaves your heart. Aortic dissection. The wall of the aorta is made up of the layers. Dissection occurs when a small tear in the innermost layer of the aorta's wall allows blood to squeeze between the inner and the outer layers of the wall. This can cause severe pain in the chest or back. An aortic dissection weakens the vessel's structure and can result in a rupture which may be fatal. Wall malformation. People who have Marfan syndrome can have weak tissue in their heart valves. This can produce stiffening of the valve tissue and abnormal valve functions. When heart valves don't work properly, your heart often has to work harder to compensate. This can eventually lead to the heart failure. Eye complications. Eye complications may include lens dislocation. The focusing lens within your eyes can move out of place if its supporting structures weakens. The medical term for this problem is atopia lentis, and it occurs in more than half the people who have Marfan syndrome. Retinal problem. Marfan syndrome also increasing the risk of a detachment or tear in the retina, the light sensitive tissue that lines the back wall of your eyes. Early onset glaucoma or cataract. People who have Marfan syndrome tends to develop these eye problems at a younger age. Glaucoma causes the pressure within the eyes to increase, which can damage the optic nerve. Cataract are cloudy areas in the eyes, normally clear lens. Skeletal complication. Marfan syndrome increases the risk of the abnormal curves in the spine. It can also interfere with the normal development of the ribs, which can cause breastbone to either protrude or appears sunken into the chest. Foot pain and low back pain is common with Marfan syndrome. Complication of pregnancy. Marfan syndrome can weaken the wall of the aorta, the main artery that leaves the heart. During pregnancy, the heart pumps more blood than usual. This can put extra stress on the aorta, which increases the risk of a deadly dissection or rupture. Diagnosis. Marfan syndrome can be challenging for doctors to diagnose because many connective tissues disorders have similar signs and symptoms. Heart test, echocardiogram, CT of the heart, MRI of the heart, eye test, slit lump examination. This test is for the lens dislocation. Eye pressure test to check for glaucoma. Genetic testing, treatment, medication, therapy, surgical and other procedure. More than 20 remedies in homeopathy, but the top most remedy is the phosphorus, magnesia phos, calcarea phos and zinc. Thank you very much for watching this video.